Hi, everybody. Welcome to week 3. I'm sure that you feel the same way, that it just flies by these 8-week courses, chock full of learning and lots of work, but hopefully it is going to start all coming together for you, especially this week, having completed your windshield surveys. I have already started looking at them and will be trying to get them back to you during this week, so as quickly as I can, so that I can give you feedback along with having conversations with you on your presentation. So I'm going to go through Moodle and what you have to do for week 3, another busy week. Go through from the syllabus again, all the things that you have to do for the week, and just a few reminders for what your next steps are going to be for your public health, your community assignment project that you're going to be working on creating a presentation. So I am going to share my screen here and just bring us to the Moodle site. This week, we're going to focus on ethics in the community, and the topics are application of ethics in the community and Healthy People 2030. I know Healthy People 2030 is not new to you, and I'm sure you've studied ethics at one point or another, but we're going to have a little bit of a deeper dive here. And also, I think that you're going to find if you really reflect and look at what you did for your windshield surveys when you were out in your communities, you really are going to be able to think deeply about how you're going to apply this topic in particular to your presentation topic and what you decide to incorporate into your presentation. So your learning objectives for the week are going to be to analyze ethical dilemmas in community health nursing using public health ethics principles to balance individual rights with population health needs, and that's going to be linked to your student learning outcome 3. You're going to evaluate a Healthy People 2030 objective in the context of a community health status to propose evidence-based nursing interventions that address ethical considerations. So this is going to be exactly what you do with your project. That's linked to student learning outcome 2. And you're going to integrate public health ethics principles into communication strategies to advocate for equitable and socially responsible health interventions in community settings. So again, you're going to be thinking about these things as you prepare to find a site where you're going to be delivering your presentation and thinking about the just making that pitch to whoever your contact is, to determine where you're going to teach this and to think about how you're going to do this in an ethical way as well. All right, so I'm bringing you now just into the syllabus for week 3. Again, we talked about what your topics are. One of the ways that we are going to meet those objectives and learn this week are going to be doing some readings. So there's 2 book chapters that are here for you, okay? One is the first one is public ethics, right? And again, the second one is related to ethics as well, 2 different book chapters that we've provided for you, and then giving you the link, which you have had before, to Healthy People 2030, okay? For this week, we're going to be doing discussion post number 2. These are going to be all related to health ethics. You're going to pick one of the prompts. So you can either pick A, which is going to be related to the chapter reading, or you can pick B, which is going to be related to the review of that Healthy People 2030 site. And you're going to relate that one objective to something relevant in your windshield survey. So either way is fine. Make sure you have your initial post due by 11:59 on Wednesday and respond to 2 peers by Sunday 11:59. So this week for the clinical assignment, you're going to be reaching out to community venues to determine where you can do your presentation, the date and the time, so that you can disseminate the findings or the teaching that you determine is needed from doing your windshield survey. Now, before you do that, you do need to have my approval. So what you're going to have to do is send me an email with what your plan is. Now, I do have your windshield survey, of course, but I do want to hear a little bit in just very briefly in case I don't want anyone to have to wait to reach out to their community partners. And I'm not sure, the order in which I'm going to be able to grade those and I will start working on them, but I don't want to hold anybody up. So I think the best method is going to be for you to email me just a quick little proposal, nothing fancy, just what your findings were, what you plan for creating your presentation, and where you plan to reach out. And I will quickly email you back and give you the approval so you can contact the venue. Okay. That is what you have for your clinical assignment for this week. And that's just the gist of what I wanted to go over with you. So I really look forward to going through your windshield survey papers this week. I'll give you feedback. I'm going to write comments directly on your Word documents and email those back to you. And then I will put your grade in Moodle. Currently, the rubric is not embedded in Moodle. I've requested to have that done. If for some reason that doesn't happen, I'll put the grades in and I'll put the rubric in your comment box, okay? So if you have any questions at all, please don't hesitate to reach out. If anybody's feeling a little confused or needs a little guidance, I've already responded to a few people by email. Please feel free to send me an email, and I'm always willing to also get on a Zoom if anybody needs it. Okay, so I hope you guys have a great week 3, and I look forward to seeing you guys online. Okay, take care. Bye bye.